background. Before I became a travel nurse, I was a staff nurse, and I was a staff nurse in the float pool. So if you're going to ask, do I like float pool nursing or being a float nurse? I do enjoy it, because I wanted to say that I'm only there that one day, I'm only there those 2 shifts. I'm able to move around. Hence the reason why I probably like travel nursing, because I'm just like, it's only 13 weeks at this hospital. It's only 4 weeks at this hospital. It's only 8 weeks at this hospital. I'm not gonna be here for long. You know what I mean? Like, that's my mind. That is my full mindset. And
I wake up every minute with the fever dreams. I push my mind to a limit where it needs to be. I work blind, got vision I don't need to see. I'm picking mind over matter, I believe in me. I need to find more hours in the day to breathe. Need to find more power in the way I be. And when my mind turns sour with the painful scenes, I need to scream out loud, I can't stop me.
hey guys, it's me, Jazzi Allegra, and let's talk about what a float nurse is. Do you want to become one? Is that your thing? Have you not found a floor that you like? Have you heard about maybe a higher wage of being a float pool nurse? Or are you taking a travel assignment and they said you're going to be part of the float pool? What does that look like? We're going to get into it into this video right now. But if you haven't already, go ahead right now, subscribe, comment, and like anything in this video at any time, and make sure you give this video a thumbs up, because it really does help my videos. And let's follow each other on Instagram at nurselife_Jazzi Allegra, and we can be friends there. Sure, inspiration, sprinkle kindness like confetti. I keep saying this confetti business, this is not working for me. Let's just roll into it. Okay, being a float pool nurse or a float nurse, I'm gonna be honest with you, you either love it or you hate it. And I'm sure if you're a part of a unit already and you have to float out to help census numbers or whatever have you, you probably hate it because you like having your floor, you like knowing exactly the kind of set routine that you have for your unit and what's expected of you. And that's the safety of being a unit-based nurse. But when you have to float out there, you're gonna have to deal with other units' specific expectations, and they're different. So you have to get used to the certain caseloads that unit specifically has. So like if you are from the transplant floor and you happen to be floated off to orthopedics, I get it. It's a different world, it's a different expectation, it's a different brand of clientele. You're used to your crew, your doctors that are coming there, and your surgeons that are coming there to see their patients. It's going to be hard. Floating can be scary, especially when you are going to an area that you are not really confident in, or even can predict what the expectations or the flow of the day is going to be. Safety is in comfort. Comfort's in routine. That's not float pool nursing. I like to argue that with float pool nursing, there is kind of a routine. It's the routine of just doing what basic nursing is. That is your assessment, that is proper documentation along with proper medicational pass, and alerting the doctors and PAs and NPs of proper critical things. And lastly, just asking the fundamental questions of what this floor needs, right? How many times do you document your assessments over here? Do you guys have something specific that you want to see in your assessment charting? Right? What are your typical critical things that you guys like harp on that their doctors need to know, besides the normal things of like a low or high laboratory value or some kind of vital signs with not being within a normal limit? Like, ask those questions. And if you can't get all those questions answered in that one thing, and you're just like not into it, asking all those questions right there, full front and frontal, then ask who your resource nurse is. So that's probably going to be your charge nurse, or I'm going to be right now, I'm going to find the oldest nurse on the floor, because homegirl or homeboy got all the tips and the tricks to know how to get you through that day, that shift, those 13 weeks. Float nurse is a nurse who moves from unit to another unit. And for some hospital systems, that could mean from hospital to any kind of sister hospital system within the area. So if you're worried that you're gonna float and you're like, it's gonna be without my scope, honestly, if you are a telemetry nurse or you're a med surg nurse or an ICU nurse or an ER nurse and you're considered a float nurse, they're gonna float you within the capacity of your scope. So a telemetry is gonna go telemetry. You may even get down to med surg because med surg is a step below telemetry, so you're able to handle med surg patients. The same thing goes for ICU going into telemetry or intermediate care nursing or progressive care nursing, because it's a step below you, but it's still within you. But you're still gonna be within your scope of care. And if anything happens or assigned to you that you have never done, never seen, or feel like it's without not being in your scope of just knowledge and actual care, then say that. Like, I've hung this drip, but we don't titrate this drip. I've never learned to titrate this drip. I know how to run this drip at a standard rate. I've seen this tube, but usually the tube is already placed in it, and I know how to manage the tube. I don't know how to insert the tube. Like, let them know what your limitations are, because you're there to help them. It's not a test of how well your nursing skill is. They need you. Their census is low. They need you to fill in the gaps in the numbers. And unfortunately, that's your charge nurse sometimes if they don't have a dedicated resource nurse for that. I mean, who wants to be a charge nurse? You gotta put out them fires. Boop, boop, boop. Okay, so let's describe exactly what the job is. The job of float pool nurse is going to differ from facility to facility as well as state to state. So the basic job description is just patient care and monitoring patient health conditions. Your normal duties like charting, communicating with doctors and staff are basically for every hospital. It's just a nuance of how they want you to do it and chart it. So float nurse skills, I think I've already said this before, but like, do what you feel comfortable doing. Honestly, it's probably going to be the basics of nursing, which is your assessment, you're communicating with other interdisciplinary team members, passing medication, and if anything that you are unaware of or have never done inside your skill and scope of practice, state it. Questions don't mean that you're an idiot. It means that you're asking questions. You're holding people's lives in your hand. So asking questions and getting clarification on certain things, especially from your charge nurse or even from a doctor or pharmacist, means that you're being a diligent nurse, not a dumb nurse. So that goes into coming back into finding your resource nurse that's going to be able to bounce questions off that person, and whether it be the charge nurse or maybe all the nurses are able to help you in answering just regular questions, like important questions like, how do you guys handle your code blue? How do you guys handle if you have a code blue, a rapid response? How do you guys chart your assessments? Is it one charting assessment, one full head to toe assessment, and any kind of focus assessment if anything untoward happens during the shift? Is it two documented assessments? You want to know where supplies are, like where's your supply room, your dirty supply, codes for doors if it doesn't like badge open for anything, how to get into the medical pick sets. Is that something that you have to call pharmacy for, or can the charge nurse go ahead and add you in for the day to pull out medication? Like, those are questions you need to ask so that you can establish yourself to have a great shift. It's not going to say that you're going to look a little lost, because you are. Let's just be honest, you are. Get over it. You're going to look lost. That's the comfort of being a float pool nurse. I love looking like the lost chick. If you're a float nurse and you're like, I'm not getting this, I'm not feeling this, this is whatever, let me just leave you with this. let me just leave you with this. Resilience takes time. And your expertise level of nursing also doesn't just happen. It's a gradual progression of learning, of seeing things hands-on, reading, and like continual education. So don't think that because you had to ask so many questions on one unit and the next unit you float to, you were able to navigate practically independently. Doesn't mean anything. Remember, questions don't make you a dumb nurse. It makes you a diligent nurse. So I hope that kind of clears up what it looks like to be a float nurse. So if you're going to be a float nurse as a staff nursing, as a staff, permanent staff in a hospital, that's basically how it looks like. As well as if you're going to be a travel nurse going into an assignment as being a part of the float pool team. I mean, as a travel nurse, to be honest with you, you're probably the first one to get floated, even if you're assigned to a floor. So, and if you're a float pool nurse, like you should, I mean, if you're a travel nurse, like you should really be okay with moving around generally all the time. I say that, and there's probably like a handful that's like, I hate floating, I put it in my contract, which you probably could. Hey, contracts are for negotiation. I mean, the worst that they can say is a no. I do digress. I guess the only thing to leave you with is, I'll say it. You'll be a great nurse. You are a great nurse. I'll see you in the next one. Next week. Bye. I need to find more hours in the day to breathe. Need to find more power in the way I be. And when my mind turns sour with the painful scenes, I need to scream out loud, I can't stop me. I wanna be the greatest.